Hello and welcome to Lyra Nara. And today we are going to talk about a stealth pathogen called Chlamydia that can cause a lot of health problems, as you will see. And millions and millions of people are infected by Chlamydia and they don't know about it. We're gonna talk about all of the symptoms of the chlamydia infection, how to detect it, and of course propose a natural treatment plan based on natural remedies and supplements as well as bioenergetic devices that really works. So let's get started and learn more about chlamydia and what to do about it. So did you know that infections with Chlamydia trachomatis are among the most frequent causes of sexually transmitted diseases? And infections of the upper inner eyelid that can lead to blindness, that is called trachoma, are worldwide among the most frequently occurring ocular infections, with 140 million already infected and 500 million being at risk. Did you also know that infections with Chlamydia pneumonia is a very common respiratory disease with a seropositivity as high as 45% in adults, generating arteriosclerosis and lung cancer, but also COPD and asthma, according to Malates and Rudel. They published this in 2013. Also, most chlamydia infections are asymptomatic and thus go undiagnosed and untreated, which leads to chronic inflammations and irreversible tissue and organ pathology, according to Daniel Roque, and he published his findings in 2011. And despite aggressive control efforts, Chlamydia trachomatis infections have continued to constitute a serious public risk. And chlamydia is also a Lyme co-infection that is often overseen. It is also found in house flies, fleas, lice, and mites. And 100 million people in the US alone are asymptomatically infected with chlamydia. In 2012, the CDC received 1.422976 million reports of chlamydial infections from 50 states plus Washington, D.C., and this was the largest ever reported number to the CDC. So unfortunately, not only are millions of people already infected with chlamydia and often they don't know about it, but it's on the rise. So let's understand chlamydia better, because there are many types of chlamydia, as you will see. And the chlamydia in general are unusual microorganisms. Initially they were believed to be viruses, but thereafter they were reclassified as so-called gram-negative bacteria. And today it is believed that these microorganisms are parasites because their exterior wall is atypical for gram-negative bacteria because it is hardier. And like many other Lyme co-infections, chlamydia reside inside of the host cells and they scavenge and live on the host nutrients. And the symptoms depend on the organs where the chlamydia has found its domicile. And there are 9 known species of chlamydia, being C. trachomatis, Chlamydia pneumonia, Chlamydia muridarum, suis, abortus, pecorum, psittaci, felis, caviae. And the first 5 of those are species that infect humans. Most often found is, however, Chlamydia trachomatis and Chlamydia pneumonia. Also, cats and dogs are often infected with Chlamydia felis, and they can transmit this type of chlamydia to us humans. As with other stealth pathogens, each chlamydia species creates numerous subspecies of themselves, which are called serovars. And Chlamydia trachomatis shows 19 serovars, each manifesting itself through different symptoms. They also share genetic material with each other. For example, Chlamydia trachomatis shares genetics with Chlamydia abortus. Chlamydia are ancient organisms and have played an extensive role in the evolution of other life forms, and chlamydia, like other parasitic microbes, scavenges ATP from the host cells, causing extreme fatigue. Chlamydia proteins and genes appear to root to many, if not most, of the pathogens that accompany Lyme disease, and genetic analysis have found that the amoeba infected with chlamydia bacteria are the oldest genus, followed by the plant chlamydia infection, the animal chlamydia infection, and the newest one being the human chlamydia infecting species. And chlamydia jumped on people a long time ago from cats, altering their genome, enabling them to utilize humans as primary reservoirs, so to speak. And in this graph you can see the chlamydia subspecies with chlamydia pneumonia, Trachomatis, and psittaci with all of their serovars that we talked about. And infections with chlamydia goes through different distinct stages. So let's learn about those stages. The first stage is the so-called minimally metabolically active extracellular bodies, or EBs for short. They are extremely hardy spore that seeks for the best soil, so to speak, to thrive, which is found in the epithelial cells that line the mucosal surfaces of your body, so the vagina and the cervix, the colon and the rectum, the lungs and bronchi and your eyelids, or the endothelial cells found in monocytes, macrophages and smooth muscle cells. And once it arrives in those targeted cells, the chlamydia alters those cells' functions to enable their bacterial replication, and they create a vacuole or invasome with the host cells that allows the chlamydia cells to penetrate into the host cells, and this is a typical parasitic behavior. And the invaded cells are thereby being stripped by their own defense mechanisms such as apoptosis, and the EB forms are not susceptible to antibiotics. Second stage is that a metabolically active reticulate body, or RB for short. It appears in about 8 to 12 hours post-infection through a conversion of the EBs, and after 48 to 72 hours the RBs exit the host cell by destroying the host cell, or chlamydia RBs extrude their vacuole through the cellular membrane, creating new EBs. Third stage is that the minimally metabolically active aberrant bodies appear, so AB for short, and those are being created through the years of chlamydia infection. They continually damage the host body through inflammation, and these forms are favorized by antibiotics, gamma interferon, tryptophan depletion, iron deprivation, extracellular adenosine, and co-infection with herpes simplex virus or porcine epidemic diarrhea virus. And this hibernation survival strategy is similar to the Lyme encysted forms. Once the stressors are removed, the ABs convert into EBs, and the chlamydia has chemotactic compounds to find new host cells to continue their proliferation cycle. Chlamydia also strongly modulates the host's immune system. About chlamydial infections of the GI tract, we have to know that they are mostly found in the cecum and rectum, and here they produce and create different bacterial stereotypes which spread throughout your body, especially after a successful antibiotic treatment. And this is a continuous inoculation through the feces of animals and humans, and animal farms, pets, water treatment plants, all of those are carriers of the EBs of chlamydia, and so this infection then can spread to millions and millions of people. And this graph offers you a nice visualization of the life cycles of the chlamydia that we have discussed, going from the EB stage through the RB stage, etc., etc. And chlamydia manifests itself through general symptoms, but also chlamydia species-specific symptoms. So let's talk about those. Most chlamydia infections are with Chlamydia trachomatis and Chlamydia pneumonia, as we've discussed already, followed by Chlamydia abortus and Chlamydia psittaci. More than 90% of the cervical infections in women and over 60% of urethral infections in men are caused by chlamydia, and 3 to 5 million new infections per year are identifiable. In spite of this epidemic, the medical establishment does not test or treat chlamydia infections at the necessary level, and that's why it's still spreading. One of the causes, of course. Usually chlamydia infections are symptomatic for one or another chlamydia strain, like Chlamydia trachomatis is, for example, considered specific for vaginal and cervix region, and Chlamydia pneumonia for the respiratory organs. However, many other organs can be affected, such as your cardiovascular system, your connective tissues, or your joints, your lymphatic system, and your neurological system. For example, manifesting itself through meningitis. And chlamydia are the most often identified pathogens that cause reactive arthritis as well, due to the Chlamydia trachomatis, which resides in the so-called synovial tissue, or oligoarthritis when the chlamydia synergistically works in conjunction with the Borrelia. Chlamydia bacteria also create so-called serovars or strains, which regularly exchange DNA with each other, creating new varieties. And when the membrane proteins change, the host immune system has troubles to identify those pathogens. And each strain also generates the same, but also slightly different symptoms, as I've mentioned, depending on the chlamydia type. And therefore, we need to look at the specific symptoms of the most common chlamydia types, starting with Chlamydia trachomatis symptoms. So, till today, there are 19 known strains that are labeled from A to L of Chlamydia trachomatis. The serovars A, B, BA, and C cause the trachoma of the eyes, infecting the thin membrane that covers the inner surface of the eyelid and the white part of the eyeball, called the conjunctiva. It causes inflammation and scarring, which can lead to blindness. The World Health Organization estimates in North America that about 40 million people are infected, of which 1.3 million people will become blind due to the trachomatis infections. The major route of infection is so-called auto-inoculation. So when you rub your eyes with unwashed hands, especially after defecating or touching your genital organs, or through houseflies, which, as we all know, often get in contact with excrements. Serovars L1, L2, L2A, L2B, and L3 cause so-called lymphogranuloma venereum, or LGV for short, which is an infection of the lymphatic nodes, and the lymphatic nodes are infected by trachomatis. The nodes in the groin and around the rectum are enlarged, and this creates painful bowel movements, labial swelling, pain sores on genitals, or blood, as well as pus from the rectum. The serovars D, DA, E, F, G, H, I, IA, J, A, and K infect the reproductive tracts of 50% of men and 75% of women. And those genital infections may cause in women different symptoms, such as acute urethral syndrome, urethritis, Bartholinitis, cervicitis, endometriosis, pelvic inflammatory disease, periphatitis, reactive arthritis, ectopic pregnancy, chronic pelvic pain, miscarriages, and 2/3 of the cases of the tubal factor pregnancy, also preterm labor, low birth rate, neonatal death, postpartum endometriosis. Transmission also to babies during birth can cause conjunctivitis, pneumonia, as well as nasopharyngeal infections in the babies. In men, these strains can cause urethritis, epididymitis, prostatitis, which is many times also the cause of prostate cancer, seminal vasculitis, infertility, and reduced sperm counts and density. And often the prostate secretions are filled with chlamydial organisms, and many sperms show also a defragmented DNA, which actually can cause baby malformations. Co-infections with the mycoplasma increases also the severity of the symptoms, and there are over 600,000 newly infected men each year. And the major symptoms are nodules, edemas, urinary difficulties, urethral discharges, and pain. Arthritic symptoms include 50 to 80% of the Trachomatis infections also, and Trachomatis can also infect your central nervous system, triggering the meningoencephalitis, MS, Alzheimer's, autism, schizophrenia, vegetative states, and a full range of other psychiatric disorders. The next very commonly encountered type of chlamydia is so-called Chlamydia pneumonia, and here are the symptoms of this type of chlamydia. Chlamydia pneumonia are primarily respiratory pathogens, as the name already suggests, so they infect the lung tissue and your bronchi. However, this chlamydia strain can disseminate via infected macrophages deeper into the lungs, also your arterial vessels and joint tissue. Houston and others found in 2014 that most of the world's populations was and is infected with this pathogen, so it's very common. Some acute infections do occur, but most of the infected people with chlamydia pneumonia are chronically infected. Chlamydia pneumonia infections are also asymptomatic, and they manifest with the following: mild upper tract respiratory airways infections, but also low-level respiratory chronic infections, which can develop into severe compromises of the lungs and your bronchial system. Also pharyngitis, sinusitis, otitis, acute bronchitis, exacerbation of chronic bronchitis, asthma, pneumonia, and COPD. Long-time persisting chlamydia pneumonia infections can also develop into lung cancer. And because chlamydia pathogens stop cell apoptosis, or cell death, it can induce cancers, from which the most common one is the lymphomas, which is the condition in which the cells cannot die. They can penetrate also deeper into the tissues, such as your liver tissue, your heart, your brain tissue, also your eyes, and the cells of the vascular system. Blood vessels that are affected by chlamydia can lead to heart infection also, chronic coronary diseases, stroke, and atherosclerosis, because it creates atherosclerotic plaque, and it also increased intima media sickness in children. More than 70% of the population with serious cardiovascular conditions are infected with this chlamydia pneumonia, and atherosclerosis is a form of arteriosclerosis with a plaque that is formed from white blood cells, so macrophages, dead and alive, together with calcium, various fats, and fibrous connective tissue. The arteries walls begin to bulge, and they become bulbar or sausage-like in their appearance, and this is one of the major causes of the serious vascular conditions that you then develop. Chlamydia pneumonia is one of the major causes also of arthritis and diabetes, and both the Chlamydia trachomatis and Chlamydia pneumonia infect the brain, causing severe neurological problems such as meningoencephalitis, MS, ALS, Alzheimer's, autism, schizophrenia, vegetative states, brain vasculitis, and other psychiatric disorders. The Mycoplasma, followed by the Chlamydia and Borrelia infections, are also the #1 causes of all of the above mentioned neurological conditions. Next on the list of the very common types of chlamydia is Chlamydia abortus and its symptoms. Chlamydia abortus is a very common problem in zoos and farms and among those who keep animals like horses, rabbits, goats and sheep. It is transmitted to us humans via intake of or contamination by feces, urine, aborted fetuses, placenta, vaginal discharges or other animal secretions or while you're cleaning the animal's habitat. Symptoms are malaise, flu-like symptoms, mild dry cough and dyspnoea, which can progress into more acute respiratory diseases. Pregnant women also may experience abortions accompanied by severe complications which can sometimes be even fatal. Other diseases to look out for is arthritis, pneumonia, conjunctivitis, vesiculitis, which is an inflammation of the seminal vesicles in the male, as well as epididymitis, which is an inflammation of the epididymis. The epididymis is a tube that is located at the back of the testicles which stores and carries sperm. And both vesiculitis and epididymitis lead to ejaculatory problems as well as prostatitis. It can also infect the neurological system with the same symptoms as we've discussed for Chlamydia trachomatis and Chlamydia pneumonia before. Another very common form is called Chlamydia psittaci. Chlamydia psittaci primarily infects birds, and those who have domestic fowls are often infected therefore by this Chlamydia strain. And this strain generally infects the lungs and can cause severe respiratory distress, leading also to death or lung cancer. And this Chlamydia psittaci causes also non-gastrointestinal extranodal mold, which stands for mucosa-associated lymphoid tissue, but also B-cell lymphoma in the lungs, thyroid problems, salivary glands, also serious illnesses, and ocular adnexal lymphoma, OAL for short, as well as skin rashes. And in Hashimoto's thyroiditis and Sjögren syndrome patients, Chlamydia psittaci DNA can also be found very often. And this strain is also involved as a causative factor in so-called myopithelial sialadenitis, or MESA for short, or Mikulicz disease. And this condition is sometimes successfully treated with chemotherapy and radiation therapy. Chlamydia psittaci is also a source of genital as well as neurological infections, similar to all of the other chlamydia strains that we've discussed. Okay, and now that we better understand chlamydia, all of its different strains and the symptoms we have to look out for, how can we diagnose chlamydia for sure? Well, successful diagnosis of those chlamydia infections is often unfortunately very difficult, and there are no serological criteria for persistent infections today. The most accurate tests for these chlamydia strains are so-called nucleic acid amplification tests, or NAAT for short, of which polymerase chain reaction is just an example. This test, however, can lead often to false negative results, unfortunately. Another test is the so-called ELISA test, or enzyme-linked immunosorbent assay. It's a quick test and not sensitive or reliable as the NAT test. The next test is called DFA, or direct fluorescent antibody test, and this one is very similar to ELISA with all of its limitations. Bacteria cultures tests are also problematic. According to Campbell and Rosenfeld, they noted in 2014 that chlamydia cannot be cultured from the lungs, although the PCR test is positive. Invasive diagnostic procedures are another possibility, and tests within the reproductive tract but those have been found to exacerbate even the chlamydia infection. We here at Lyra Nara offer you, however, DNA scans to identify with high accuracy chlamydia infections as well as infections with hundreds of other pathogens. And for doctors and professional healthcare givers, we highly recommend to use electrodermal screening testing. And here one of the greatest devices that you can use for that purpose is the so-called Vistron together with the Homopath software. I'm going to link it in the description box below for you. And this will help you diagnose with a very high accuracy chlamydia infections as well as many other pathogens. And with that being said, we come to maybe the most important and interesting part for you of the presentation, which is how can we treat chlamydia infections? Well, similar to Mycoplasma bacteria treatment, a therapy of chlamydia infections must take the following into consideration. First, you must replace the nutrients that have been scavenged by the chlamydia. Secondly, you must reduce the specific cytokine cascades that chlamydia has initiated. Then you need to boost your immune system and mitochondrial respiration. Then you need to support and repair the organs and the neuronal cell damages. You must take care of the specific symptoms that we've discussed. And last but not least, you must also support your lymphatic system and liver detoxification. And these intracellular parasites maintain a very delicate balance between exploiting and protecting their host cells. So they occupy intracellular space and acquire nutrients from infected cells, but at the same time they have to maintain the integrity of the host cells for the completion of the intracellular growth. And for these purposes, the chlamydia hijacks certain signaling pathways that prevent the host cells from undergoing apoptosis and protect actually the infected cells from recognition and attack by our immune system. Much better than pharmaceuticals is herb treatment. They are very good for subtle remodulation of your immune functions, and the herbs are also very good in reducing or for reducing cytokine cascades that cause the inflammatory damages. Those herbs are also very effective in protecting your organs and your cellular systems that have been adversely affected, and in reducing or eliminating many symptoms that the chlamydia infections generate. So let's propose a holistic chlamydia therapy. Because the good news is that all of the chlamydia bacteria strains that we've discussed can be treated with the same basic protocol. And we must address again the following aspects. First, an antibacterial treatment, then replacing the nutrients that have been scavenged by the chlamydia. Then we need to reduce the specific cytokine cascades that chlamydia has initiated. We also need to boost our immune system and the mitochondrial respiration, support and repair the organs and the neuronal cell damages. We also need to treat the specific symptoms of each chlamydia strain, support the lymphatic system and help with the liver detoxification. And also of note is that if your immune system is easily able to produce so-called IFN gamma, the chlamydia infection is significantly inhibited, and the best herb to exacerbate this function is astragalus. Take 1000 milligrams daily permanently. Other antibacterial herbs that are highly recommended, the most important one are herbs that contain so-called berberine, like golden seal, philodendron, and Chinese coptis, as well as Chinese skullcap root. And these herbs protect the Golgi structure from fragmentation. They also inhibit inflammatory responses in your macrophages. They show tonic effects in your spleen, liver, lungs, heart. And they reduce the reinfection in deeper tissues, and they also normalize the intestinal flora and restore your microbiome. And to treat chlamydia in the vaginal tract, you can use berberine suppositories. For chlamydia trachoma in the eyes, you can use berberine eye drops. And retinoic acid acts also as a chlamydia antibacterial and inhibits chlamydia endothelial and epithelial infections and the development of atheroma in your aorta. Thus, take lots of vitamin A as well. And here is a core protocol for all chlamydia infections. That will help you eliminate chlamydia in about 30 to 45 days. More serious infections, of course, will need the protocol to be repeated as necessary. And we recommend chlamydia as an antibacterial treatment. Our proprietary Vivid Artemisinin together with Herbesor Chlam, our proprietary blend of ultra-pure pharmaceutical-grade DMSO with berberine containing herbs. Dosage half a teaspoon 4 to 6 times per day for 6 to 8 weeks. We also recommend Herbesor Cytokine Stop, which is again our proprietary blend that combines ultra-pure DMSO with other different beneficial herbs. Dosage again half a teaspoon 6 times per day for 8 weeks. Also recommended is the immune booster because, as we've mentioned, we need to maintain our immune system in perfect working order, and here the Herbesor immune booster will help you. 1 teaspoon 6 times per day for 8 weeks. New also our Herbesor membrane protector, which protects the mucous membrane structures. Again, our proprietary blend of ultra-pure DMSO with different beneficial herbs such as Bidens pilosa. 1 teaspoon 6 times per day, 8 weeks. Herbesor lymphatic and liver stimulation is also highly recommended. It's a proprietary blend again that you can only get at lyra.me of ultra-pure DMSO with different herbs to stimulate and detox the liver and your lymphatic system. You take again 1 teaspoon 6 times per day for 8 weeks. And next, the Herbesor MIT or Mitochondria Energy Boost, which is again our proprietary blend of ultra-pure DMSO with different beneficial herbs. 1 teaspoon 6 times per day for 8 weeks. I'm going to post the links, of course, to all of those products in the description box below. And all of those products are, of course, as all of our natural remedies and supplements, without any additives or conservants or anything like that. They are just pure DMSO and organic herbs and minerals as well as vitamins that are blended together in a very specific manner in the right proportion to achieve the desired results. If you are suffering from vaginal infections due to the chlamydia, we recommend Herbesor vaginal suppositories. Also Herbesor Chlam core protocol when you're suffering this that we've discussed in a previous slide. Plus for 14 days berberine suppositories made of Hydrastis canadensis, golden seal, Echinacea angustifolia, and Scutellaria bicalensis for, as I've mentioned, 14 days. The Herbesor Chlam core protocol also plus should be accompanied by the following supplements. For male chlamydial infection that induces poor semen, we recommend that you take also L-arginine 6,000 milligrams per day, L-carnitine 2,000 milligrams per day, acetyl L-carnitine 2,500 milligrams per day, and also Panax ginseng tincture half a teaspoon 3 times per day, and all of those together for 2 months. Also the Herbesor Chlam trachoma. If you're suffering from this, we recommend that you follow the Herbesor Chlam core protocol that we've discussed, plus berberine eye drops, 3 drops throughout the day for 2 months. And we've already discussed that part of the chlamydia treatment is that we need to replace the scavenged nutrients. How can we do that in a natural way? Because the chlamydia bacteria utilizes many of our body's own nutrients. We need to replace this, and replenishing those depleted nutrients can be done by combining an adequate nutrition, so adequate diet, with the following supplements and herbs. So, regarding the diet, we recommend a mucusless or non-acidic diet as the best one. And regarding supplements, we recommend B vitamins because they are deeply scavenged by the chlamydia. So take them through nutrition as well as supplements. But also choline, 500 milligrams daily. Also eggs, dark chocolate, and peanuts contain choline. Zinc, 50 milligrams daily. Seeds such as sesame, pumpkin seeds, but also watermelon and garlic, they contain a lot of zinc. Copper, 2 to 5 milligrams daily. You can find copper also in liver, oysters, and seeds. Selenium, 200 mcg daily. Also found very in high amounts in eggs, mushrooms, poultry, onions, and grains. Amino acids, all of the amino acids. Fatty acids, you can consume here coconut and olive oil, about 250 grams daily. And RNA and DNA complex, 500 to 1500 milligrams daily. You can find this, for example, in chlorella and spirulina. And last but not least, you can support these natural supplements and the treatment of your chlamydia with bioenergetic therapy devices. And here first on top of the list must be galvanic therapy. Is one of the most important and potent therapy procedures to assist the treatment of mycoplasma. And here we offer the Veget Balance Home for home use, as the name already suggests, and a Veget Balance TheraPro for clinical galvanic therapy. Links to all of these bioenergetic devices, by the way, also in the description box. Exceptionally helpful is also microcurrents therapy with the diamond shield crystal, which comes with specific chip cards for Lyme disease and its many co-infections, of which chlamydia is one, as we've discussed. To recover, detox, and help restore the functions of the different cells, your tissues, and your organs, we also offer photon and laser therapy systems. And for consumers, we recommend the ultra compact laser disc, or ULD 117 for short, and for doctors, the MPS 912. And to improve the lymph and blood circulation, as well as ameliorate the symptoms and relieve pain, we highly recommend the Aquatone Advanced for home use and the Aquatone Professional for doctors. We also need to restore the ANS balance and trigger autoregulation. And here we recommend another exceptional device called the Kindling Easy. It's totally automated, very easy to operate, and therefore you can use it at home or professionally as a doctor as well. And if you have any further questions about chlamydia and you need personal consultation, please do not hesitate to contact us. Shop at lyranara.com. I'm also going to post the full contact information, including our toll-free phone number, in the description box below for you. If you've enjoyed this presentation, please also do not forget to like, share, and subscribe to support our work. And with all that being said, stay healthy until next time.